Am I checking for diastasis recti the right way? Imagine feeling unsure if your postpartum belly is healing properly. You're not alone, and checking for diastasis recti can seem tricky at first. Let's walk through how to do it correctly. First, lie flat on your back with your knees bent and feet flat on the floor. Keep your spine in a neutral position to avoid strain. Place your fingertips gently along the middle of your abdomen, especially above, at, and below your belly button. Now, engage your core by lifting your head slightly off the floor. This activates your abdominal muscles and makes any separation more noticeable. Feel for a gap or a bulge between the two sides of your rectus abdominis muscles along the linea alba, which is the connective tissue down the middle of your belly. If you find a space that is about 2 or more finger widths wide, especially if it feels soft or lacks tension, that could be a sign of diastasis recti. This simple finger width method is a common way to do a quick self-assessment. It gives you a rough idea of whether there might be a separation. But keep in mind, it doesn't give an exact measurement of the space between the muscles, called the interrectus distance. For a more precise assessment, healthcare providers or physical therapists often use ultrasound imaging or calipers. They also evaluate muscle tone and tension, which are important because a wider gap with good tension might not be as concerning as a smaller gap with poor tension. Remember, some separation is normal during and right after pregnancy. Most of it heals naturally within the first 8 weeks postpartum. Feeling tension when you engage your core is a good sign, even if the gap is wider than 2 centimeters. Conversely, a small gap without tension might still need attention. For the best recovery, consider consulting a physical therapist experienced in postpartum care. They can do a detailed assessment and guide you through safe exercises to help close the gap and strengthen your core. Avoid high-impact or strenuous abdominal exercises until you get clearance from a professional, as these can make things worse. To sum up, your self-check should include lying flat, gentle palpation along the linea alba, and engaging your core to feel for both the gap and tissue tension. While this method is a good starting point, getting a professional opinion will give you the most accurate picture and personalized plan for recovery.